Director Jones. I encourage everyone to participate in the mask pickup for children. It's critical that we get masks to individuals who need them, and particularly masks that fit appropriately. So we're excited to partner with Director Jones and her team to get masks out to children. I also want to welcome you to this afternoon. We're going to take a little bit of a different route on our Thursday joint press conference. As you know, we typically give a lot of data on Thursdays, but we have had a lot of questions relative to Health Directive 12, so we want to make sure that we dedicate enough time for questions and answers today. So I'll give a brief update on data, and then Dr. Randolph will join me and he'll give some updates on the Health Directive, and then we'll open it up to specific questions. So as of this morning, we have 30,837 cases. That's an increase of 147 since yesterday. So we are back down to where we were prior to Labor Day, where we have some fluctuations in numbers, but they're really hovering in the low 100s, which is positive. Unfortunately, we do have over 400 deaths that we've experienced within Shelby County. I want to speak specifically to some gating criteria, and these are gating criteria that we've looked at not only in Shelby County, but across the United States from the very beginning of the pandemic. And it is the context of all four of those gating criteria that influence our drafting of the Health Directive and our movement forward for either county-wide interventions or more laser-focused interventions. So clearly, we always look at the scope of the pandemic locally. What do our numbers look like? What is our reproductive rate? What is our duplication rate? What are our numbers and our trends relative to communities around us? And what are those trends relative to our historic experience with the pandemic? So as we know, we had reached the majority of what we had identified as tripwires prior to Labor Day, with the exception of the 30% reduction. I want to remind everyone that the tripwires are not a checklist. They are a list of metrics that we consider relative to the other items that I'm going to cover. But we were really at that point before Labor Day. Dr. Randolph and I, as well as with input from others, really decided that we needed to wait and see the impact of Labor Day. We were at a pivotal point. We did not want to experience in Shelby County what we did in July, so that we needed to wait out at least 2 weeks past Labor Day to see the impact of Labor Day. But that we also needed to experience and look at the experience of schools reopening and determining if that was going to impact increases in numbers and increases in potential community transmission. And within schools, specifically getting back to sports and the impact of sports on our numbers. The second gating criteria that we've looked at from the beginning is testing capacity. We have significant testing capacity in Shelby County. That's a reflection of our partnerships locally with our safety net providers, our healthcare providers, and now the health department has additional capacity for testing as well. While we have testing capacity and anyone can access testing regardless of insurance status and really regardless of whether they're symptomatic or not, we are still underutilizing testing capacity. So it's important to recognize we have capacity. We need more people to continue to get tested. The third area we look at is hospital capacity, and we do know that we have sufficient hospital capacity in Shelby County. Most hospitals have really been running in the green, occasionally in the yellow, but that is a reflection of other things not limited to COVID, including traumas. In addition to that, we also look at morgue capacity, and we have sufficient morgue capacity within Shelby County and have actually funded and supported increased capacity with the West Tennessee Regional Forensic Center. The other area that we look at, which the health department has the most intimate knowledge of, has to do with our public health capacity. We do know at the very beginning of the pandemic, and as we began to see surges and receive many, up to sometimes 400 or 500 reports per day, there was significant strain on the public health system. We have been able to build our capacity significantly through CARES Act dollars. That is by hiring new staff to augment our existing staff. Initially, 141 positions, but then ultimately adding 70 additional positions. While all of those are not filled, many of them are, which allows us to do our case investigations in a timely manner, work on contact tracing in a very timely manner, and to do enforcement and follow-up, which is critical. We do many things in public health. I think everyone is acutely aware of contact tracing, but we have a responsibility to do assessment, which is the data that we provide, the case investigations, cluster and outbreak investigations, and contact tracing as a component of that. But we also have a responsibility to do enforcement of the health directive and assure that businesses are in compliance with that health directive. So in moving forward with health directive number 12, all of those things are taken into consideration, and we believe at the current time, the decisions that we've made, particularly to open limited service restaurants and to put significant restrictions on those facilities, that we have sufficient capacity to monitor, to see the impact of that incremental change, and to intervene if there is an influence on the scope of our pandemic relative to that particular change. We will continue to monitor very closely into the first week of October, and based on our findings at that time, we may also make some additional changes.